Welcome back.
Here we go.
Yeah, we were talking earlier. We have 2 Dr. Asks.
That's double trouble.
Double trouble is right. I'm telling you. But the younger Dr. Ask has something new, and we want to know all about it.
Well, dentistry is a field where you're constantly evolving, and so it's kind of fun because you're not going to burn out unless you let it. Because you can keep learning new things, and when we wake up in the morning, like, man, this whole field's changing. So it's a lifelong learning experience. So I'm looking forward to dentistry because it's just every day I'm just like, man, there's tons of new stuff you can do, and it's exciting to
And every
constantly
patient's
learning.
different.
Yeah, exactly.
Yeah, so
and one such thing that's new is we learned in school, actually, it was first invented in Australia, is this called MI paste. It stands for minimally invasive paste, and basically it's one of the first things I've seen in the field where you actually have, it's like a calcium concentrated paste, and normally with teeth, when you have destruction, we're focusing on saving what's left, and now you actually can help put minerals back into teeth. So
really?
So if you have what's common is you have braces and it's like a plaque trap, and so bacteria will sit on the teeth, and then it causes a little, we call it a white spot lesion, so it leaves like a little white spot on your front tooth, and you're like, man, I can't, that won't go away unless we actually drill the tooth and put it in a filling. But actually with this material now, you can actually, if you're disciplined and keep it cleaned, it'll actually make the white spot go away.
So you can use this daily, though, even if you don't have braces. This is something new that for people that are much older, like myself, that it will start. It will make your teeth healthier.
Yeah, especially if you have a cavity problem.
Yeah.
So if you drink a soda, for every soda, you want to use the treatment of this.
Yeah, I don't drink sodas because you taught me that it's not good for your
Dr. Ask
teeth.
turned us off of sodas just by the sugar demonstration.
That did that. Between the teeth and the hips, you just.
So this MI paste, actually, you put it on at night, and it's just a little, just a cream. So you brush your teeth really good at night, okay, and then just put
rub
it
it
on
on
your
your
teeth,
teeth.
yeah, like this, okay, and then go to bed.
Oh, okay.
It's very sexy,
Yeah.
Tastes actually really
Am
good.
I was going to say that.
Am I paste and lace?
Yeah. So what are some of the other recent advances as far as we have an implant here? So talk to us about implants.
Well, originally when the train of thought was if you keep your teeth, and then when you lose them, you have dentures, and then that's it. And then it's just a matter of you getting your bone. When you have no teeth, your bone constantly deteriorates, and so you have to get your dentures refit like every couple of years, or else they start flapping around, at the dinner table, and they.
Don't you love that when that happens? I love that.
So anyway,
Clickety clack click. Sounds like castanets.
Yeah, and if you're a denture wearer, you know that usually the lower denture doesn't stay in as well as it should, and that's always going to be that case. And so now we have implants where it's basically they're put directly in the jaw, and you can secure the denture to the implants, and so it actually makes you're almost new
Doctor,
teeth.
I know someone that's had this done.
Oh, really?
And
what did they say?
Years and years ago, and because her teeth were just terrible, and I'm telling you, you cannot tell the difference.
Right.
It is the most unbelievable change in this person.
They can really chew really, really well.
Oh, it's just great. It's
otherwise, the denture is on floating tissue.
Yeah.
Okay. So trying to chew something when it's moving around, and so with the implants, it's secured directly into the jawbone, and they can bite into anything. Actually, the chewing ability for a denture wearer is 1/3 the normal chewing ability. If I were to have a denture wearer bite my finger, it would really hurt, but they couldn't bite through it. But if I had Cam do that, he could bite right through it. Right. Yeah. And okay.
Yeah.
So this is a patient that we actually did some implants. Do you want to show him that? Oh, okay, whatever, Cam.
Yeah, let's start with the before.
Okay.
Yeah, so this was before shot here.
So there's a lot of
damage.
Yeah, actually, it's upside down, Cam. There you go. Okay, yeah, I got this straight. Okay, so she was losing her upper teeth, and she just couldn't eat very well. She couldn't eat very healthy foods. And then this is afterwards. So we did 3 implants on the lower, and then we rebuilt her entire mouth, and she is so excited. I got the first kiss, after we got her all refitted. So she was excited, and it just changed her life. And
so you do this it's like a chick magnet then.
Absolutely. Yeah, absolutely. And this is the before.
A before and after picture here. I questioned if this was the same person.
Yeah.
She even looks younger.
She's beautiful.
Absolutely
beautiful.
Right.
Beautiful.
Yeah.
Absolutely.
And I think even just when you look in the mirror and you see yourself and you see that your teeth are nice, it makes you feel good, not just lets other people know that you are
Absolutely.
professional.
Now, how does this different? I mean, I know how it differs, but now are veneers safe, doctor? Are they safe to do the porcelain veneers?
Yeah, veneers. Yeah, they're not. Veneers usually never. It's not like a life-threatening situation, really. But I mean, veneers. There's always, say, if your teeth, like we call it tetracycline stains. Basically, it's antibiotics. Say if you had it when you were younger,
right?
When your teeth are developing, you have these horrible stains. It's hard to block out that dark stain with, say, typical composite or white fillings, and so. In a situation like that, you'd want to use some ceramic or veneers. And a veneer and a crown are very similar. It's just the veneer is like a half a crown only on the front.
Okay.
So
it adheres. It floats to the top of the tooth. The enamel.
Yeah. So dentistry is a field where it's awesome. It's just like you change people's total appearance, and they go from looking.
Look how many. People
amazing.
That are in the movie industry and that are on camera all the time. You look at old pictures of them as compared to what they look like now. 99% of them have had the veneers, and it's really beautiful.
We're going to talk about veneers at another time.
Okay, so I'll shut up then.
No, that's fine. There are some really good things happening with that. Basically, you can transform your smile into anything. So
now, is this painful?
Actually, relatively little. It's very little. So people are saving their teeth now. In Kit Carson, there's probably 10-20% of them now have dentures. Where in my practice, when I first started 30 years ago, most of them had dentures. Now is when Jared goes into the Kit Carson, most of them are not going to have dentures. People are keeping their teeth, and we have great technologies now to be able to do that.
We got to run to an ad break. We'll be back. I got a couple more questions for you, Doctor.
Okay.
Stay tuned.